Good morning. Today's topic of discussion is metabolism of branch chain amino acids. Valine, isoleucine, and leucines are the branch essential amino acids. Out of these, the valine is glucogenic, while isoleucine is both glucogenic and ketogenic, while leucine is exclusively ketogenic. These amino acids serve as an alternative source of fuel for the brain, especially under the condition of starvation. So during these conditions, the muscles breakdown leads to a vigorous amount of these branch chain amino acids, which are being taken up by the brain specially. All these amino acids undergo similar sequence of reactions, like they undergo transamination followed by oxidative decarboxylation via this enzyme, branch chain alpha keto acid dehydrogenase, followed by acyl coenzyme A dehydrogenase. So there is a common pathway for all these three amino acids. The dehydrogenase, the branch chain alpha keto acid dehydrogenase is a complex enzyme that I'll tell you what are the different coenzymes are required for sustenance of this step. Then move on to the end product of valine is a succinyl coenzyme A, which is precursor for synthesis of glucose, while acetoacetate is derived from leucine, which is exclusively ketogenic in nature. Then the end product of isoleucine is succinyl coenzyme N and acetyl coenzyme A. So that's how it is both glucogenic as well as ketogenic. So this is the more clear account of metabolism of all these three branch chain amino acids. Valine undergo transamination reaction leading to alpha keto isovalerate, followed by undergoing oxidative decarboxylation under the influence of branch chain alpha keto acid dehydrogenase, with the loss of carbon dioxide converted up into the isobutyryl coenzyme A, followed by dehydrogenase, and this reaction is this required the FAD for its sustenance. So isobutyryl coenzyme A converts to methyl acrylyl coenzyme A and followed by its conversion to propionyl coenzyme A. Then isoleucine is converting to alpha keto beta methyl valerate after the transamination reaction, followed by oxidative decarboxylation, which happens with the loss of carbon dioxide, and there is a subsequent oxidation leading to the conversion of 2-methyl-butyryl coenzyme A, which converts up into the tigllyl coenzyme A, followed by conversion to propionyl coenzyme A with the loss of acetyl coenzyme A, and followed by conversion to methyl malonyl coenzyme A in the presence of biotin, and carbon dioxide is being added here. Next step, the methyl malonyl coenzyme A converts up into the succinyl coenzyme A under the influence of vitamin B12. As far as leucine is concerned, it also undergoes transamination reaction leading to formation of corresponding keto acid, that is at alpha keto isocaproate, followed by its oxidative decarboxylation with the loss of carbon dioxide and subsequent oxidation leading to the isovaleril coenzyme A, followed by its conversion to beta methyl crotonyl coenzyme A via dehydrogenase enzyme. Then it's converted up into the HMG coenzyme A and leading to the release of acetyl coenzyme A, and the enzyme is lyase, and it's converting, the end product is acetoacetate. So what we see in this reaction, that HMG coenzyme A, which is one of the important intermediate of cholesterol biosynthesis as well as ketogenesis. And what we can notice here in all these reaction, the oxidative, the transaminations, and all these three amino acids undergo first transamination reaction followed by oxidative decarboxylation reaction and followed by dehydrogenase reaction. So oxidative decarboxylation reaction is a very complex reaction. This is the complex enzyme and which is dependent on 5 coenzyme. They are TPP, FAD, lipoic acid NAD plus and coenzyme A. Then dehydrogenase is FAD dependent enzyme. So in nutshell, the valine is ending up into the succinyl coenzyme A only. So that's why it is glucogenic, while isoleucine is converting both into the acyl coenzyme A as well as the succinyl coenzyme A as an end product. So it is both glucogenic as well as ketogenic via acyl coenzyme A. Then leucine end product is acetoacetate. It is only ketogenic in nature, so exclusively ketogenic. So this is how the fate of these amino acid decides upon whether they are ketogenic or the glucogenic. Then metabolic disorders associated with these branch chain amino acids. These are maple syrup urine disease or branch chain ketoaciduria. Then intermittent branch chain ketonuria, then isovaleric acidemia, then hypervalinemia. So most important metabolic disorder, that is inborn errors of metabolism, is maple syrup urine disease, MSUD in short. So defective enzyme is branch chain alpha keto acid dehydrogenase enzyme. That is the second step enzyme. So due to absence of this enzyme, what happened? The branch chain amino acids, leucine, isoleucine and valine and their corresponding keto acids accumulate in the blood, urine and CSF, leading to severe ketoacidosis. Due to the accumulation of these keto acids, alpha keto acids impart a characteristic sweet odor to the urine among the affected individual, and that's why the smell is like burnt sugar or the maple syrup. That's why the name has been given to the disease as maple syrup urine disease. Then second is intermittent branch chain ketonuria. That is due to the partial deficiency of branch chain alpha keto acids dehydrogenase enzyme, so leading to the accumulation of lot of corresponding alpha keto acids of all these three amino acids. So that's how there is a ketonuria. Then followed by isovaleric acidemia. Defect is in the isovaleric coenzyme A dehydrogenase in valine pathway. And then hypervalinemia is due to the defect in transaminase, and there is a significantly increased level of valine in serum and urine. Then symptoms. The neurological manifestations are due to the accumulation of respective keto acids in the brain in the form of vomiting, leading to vomiting, dehydration, metabolic acidosis, maple syrup ordered to the urine. If untreated, it leads to mental retardation, coma, and even death within 1 year after the birth. So MSUD is most important metabolic disorders. So there should be some management as early as possible in order to cope up with the situation and to increase the longevity of the infant. How can we diagnose? Diagnosis can be done via the tandem mass spectrometry by simple blood spot test or the blood or the urine spot test. Then chromatography is another way by which we can do the detection of the corresponding metabolites in order to know of the disease or disorder. So what is the treatment and management? So as such, no treatment, but the management definitely in the form of protein restricted diet with low or no leucine, isoleucine and valine. Thiamine and supportive treatment can be given, which improves the behavior of the patient. Thiamine, we have seen that it is one of the important coenzyme of the second step, that is the oxidative decarboxylation reaction. And the decarboxylase enzyme is dependent on thiamine as well. So to monitor the effectiveness of dietary treatment, the plasma and urinary level of branch chain amino acids with dinitrophenylhydrazine should be measured constantly in order to get how much is their concentration in the blood. because every time it's not possible to run the tender mass spectrometry and chromatography. So this is the easiest way to trap the concentration, trap and know the concentration of these urinary level or plasma and urinary level of these amino acids and their metabolite via the D and pH test. Thank you.